Hello, my name is Lisa Hwa. I'm a nurse practitioner at Mayo Clinic in Rochester, Minnesota. I'm here at ASH meeting presenting the result looking at the effect of immediate prime line therapy using lenalidomide or thalidomide on the response to pomalidomide in multiple myeloma. As we know, pomalidomide is the newest immunomodulatory agent or IMiDs that has shown clinical efficacy in relapsed multiple myeloma refractory to thalidomide or lenalidomide. Studies on myeloma cell microenvironment suggest that tumor subclones compete for dominance during the changes in drug therapy. The goal of our study was to examine whether and how immediate prime line use of thalidomide or lenalidomide on the response of pomalidomide in treatment of multiple myeloma. We retrospectively reviewed medical records of 208 patients who were enrolled in our previous phase 2 pomalidomide clinical trial at Mayo Clinic, Rochester. We studied their previous therapies and divided the patient into two groups. The first group of the patients received either thalidomide or lenalidomide right before enrollment in the pomalidomide clinical trial. The other group of the patients had non-IMiDs as their latest prior line therapy before initiation of pomalidomide. We compared the effective treatment duration of pomalidomide and response rate between these two groups of patients. The median prime line therapies were 3 in both two groups of the patients. What we found was that the patients who received either thalidomide or lenalidomide immediately prior to the enrollment of pomalidomide clinical trial had a significant lower response rate and shorter effective treatment duration compared to the patients who had non-IMiDs as their latest prime line therapy. We further compared the patient who responded to pomalidomide with the patient who did not. We found that the time duration from the end of previous thalidomide or lenalidomide therapy to the time of initiation of pomalidomide was much higher in pomalidomide responders, which was 10 months compared to only 3 months in pomalidomide non-responders. Patients who responded to pomalidomide had a shorter treatment duration of previous thalidomide or lenalidomide compared to pomalidomide non-responders. The difference was 9 months versus 15 months. Our study is important because the findings indicated that a shorter exposure to previous immunomodulatory agents is associated with a better pomalidomide treatment response. A longer interval between previous immunomodulatory agents and the time to initiation of pomalidomide therapy may improve pomalidomide clinical efficacy.